Well, for the past few days, my buddy here, Karen, she's been sharing her breast cancer journey. We really appreciate you doing this. And today you're actually talking about having a mastectomy and reconstruction.
That's right. Not everyone who has breast cancer has a mastectomy, but for those who do, there are a lot of options out there and misconceptions. So I invited my breast surgeon, Dr. Nicole Christian, and my plastic surgeon, Dr. Katie Egan, to come on the show. Take a look. Well, Dr. Egan, Dr. Christian, thank you so much for being here. I was saying to you earlier, it's a little bit weird because I'm not in a hospital gown and you guys aren't wearing your masks. So thanks for coming to my turf here at Great Day, Colorado.
Thank you for having us.
Yeah,
yes,
no problem.
Great to see you on this side.
So as we know, I'm a patient of yours, so I can attest to the amazing care that I've received at UCHealth. But Dr. Christian, what makes being a patient and going through the process, especially with breast cancer, so special at UCHealth?
Thank you for asking. You know, I think one of the most wonderful things that we offer is truly multidisciplinary care. So when you come to see us in the breast center, you see not only a surgeon, but you can see a plastic surgeon, you see the medical oncologist, the radiation oncologist, and we all make the plan together so we can really have a personalized plan of care for each patient. Some of the other benefits, I think, because we have such a large system, is we can do things like screening for lymphedema, pain, other symptoms that patients may have that aren't necessarily the primary cancer focus, but all of the other things that you have to deal with as a cancer patient. And I think the fact that we do all of this together as a team with the patient at the center is really what makes the experience really important and special for the patients.
And Dr. Egan, you're my plastic surgeon, so you guys both had a hand in my double mastectomy. So why go through the process of that? Why do I need two doctors? Maybe we'll just start with that.
You go first.
So I'll go first because in the surgery, I go first. The role of a mastectomy is to treat the cancer in the breast. The breast is an organ, and so a mastectomy is treating the whole organ by surgically removing the entire thing. But then, of course, we leave kind of a space behind where the organ used to be. Some patients choose to go flat and not have reconstruction, but for patients who undergo reconstruction, then I turn it over to my colleagues like Dr. Egan, who are able to take the space that I leave behind and reconstruct a breast to kind of create the best function for a patient who desires reconstruction.
And Dr. Egan, what are some of the misconceptions when it comes to reconstruction with, mastectomies?
I think that patients often have several misconceptions coming into reconstruction. First, the reconstructive process starts at the same time as the mastectomy. And a lot of patients are worried that they're going to be flat right after the mastectomy and have to wait for a second surgery. And Dr. Christian and I actually worked together on the same day when the breast tissue is removed to rebuild the breast immediately after surgery. There are a couple of different approaches on how that can happen. And depending on specific factors of the patient's cancer and their general health and their plan for treatment, again, that we customize for each patient, we determine the best plan for the reconstruction, either with a temporary device that's placed at the time of surgery or using a patient's own tissue at the time of their surgery.
And that was my case because I had a previous cancer and I had radiation therapy. So a lot of people assume that I have implants and I don't. And this is kind of weird talking about it on TV, but you were able to use my own tissue, which actually I'm really kind of grateful for, because I was a little bit leery about having a foreign body in my, body. So yeah, that's one of the avenues that some patients can go through, right?
Absolutely, and that's something that we really specialize in at the University of Colorado Hospital, and that we offer those advanced reconstructive techniques of using a patient's own tissue. Nationally, about 80% of patients will undergo implant-based reconstruction after breast cancer, and 20% use their own tissue. So a lot of people aren't aware that you can use your own tissue for reconstruction because the majority of patients undergo implant-based reconstruction. But that's something that we do more commonly at the University of Colorado, since we're one of the specialized centers that does that.
And is this covered by insurance in most cases?
It's covered in all cases, actually. There's actually a law that mandates that any insurance carrier has to provide coverage for breast cancer reconstruction. And that includes the whole process of reconstruction. So often reconstruction, again, starts at the same time as a mastectomy. And then if any additional surgeries are required, either for second stages after completion of radiation or other treatments, or any touch-up surgeries, those are mandated by law to be covered by insurance.
I had no idea that it was mandated by law. And just briefly, there is research in this discipline that's happening at the university, right?
Definitely, in breast cancer and in breast reconstruction, so we can both talk about that.
Yeah, we actually do a lot of collaborative research together, meaning the breast surgeons and the plastic surgeons, because we have so many shared patients, and better reconstructive techniques are better outcomes for my patients, better, mastectomy techniques are better for reconstructive outcomes for Dr. Egan's patients. And so we do a lot of combination research, especially around pain management postoperatively, lymphatic reconstruction, and other types of kind of cutting edge techniques.
Wow, fascinating. Well, thank you so much, doctors, for, putting me back together, but also, just coming here and sharing all your information with our viewers. Really helpful. Thank you.
Thank you.
Thank you.
All right. Well, the Diane O'Connor Thompson Breast Cancer Center is located at the UCHealth Anschutz Medical Campus. Their team of caring doctors, support professionals, and nursing staff work together to develop the best care plan for breast cancer patients. They truly stay with you from your initial appointment through your treatment and aftercare, and I can attest to that. For more information on breast imaging and tests, log on to uchealth.org.